What's up, everybody? Jed Johnson here from dieselcrew.com. Of course, you know they call me Napalm, and this is another video in 31 days of Q&A. Today's video is brought to you by Fixing Elbow Pain. And I'm going to tell you why that's the sponsor of this video once I get into a little bit of information about the question. Turn notifications off. The question today is when to hit the doctor up when you're hurt. So specifically, the question that was brought up was if we have a hand injury, at what point should the person go to the doctor or just try to address it themselves? And if I look a little weird today, I think I pulled a rhomboid. There's something right beside and even a little bit underneath my shoulder blade that is so freaking tight. I can move my arm, but there's some discomfort there. Moving my neck, if I look down too quick, it's nothing major. I didn't tear anything, but I don't know exactly what happened. So the other thing I'm dealing with is my foot hurts again. Don't know why, but if anybody's followed my YouTube channel for longer than a few months, this summer I was riddled with foot injuries, and this one is actually my left foot, which is kind of weird. So the reason that I chose Fixing Elbow Pain as a sponsor is because this is an injury recovery ebook that I paired up with Rick Caseljan. Rick is an old friend of mine, and he is a real deal therapist, like physical therapist, occupational therapist, I'm not really sure. But because so many people deal with elbow injuries in the sport of grip and strongman and steel bending, I wanted to put something together with somebody that was legit, because despite my years of experience, I'm not no freaking doctor and I'm not a therapist. I've interacted with tons of people who have provided me with information that and showed me ways that I was able to get myself out of pain without having to go to the doctor, without having to get therapy, without having to get x-rays and MRIs and all that stuff. And I've been able to parlay that into the ability to help friends, clients, stuff like that, kind of work their way around injuries and sometimes actually resolve them. And I get a lot of people who comment on the YouTube about, hey, I've got this injury, what do I need to do to fix it? And generally I stay as far away from that stuff as I can. Unless it's a friend, a client, online client, someone that comes here to the gym, I usually don't try to fix people's injuries because that's not my scope of practice. However, I want to, was hoping for a little more detail on this question, but I want to just kind of give some general guidelines. The problem with going right to the doctor every time you're hurt is that a lot of this stuff will resolve on its own. It's just going to take some time, and you won't need to like miss workouts or anything if you give the area that's injured time to heal. So a lot of times what I will do is if I have an injury, I will work around it. So if a specific movement pattern I know is going to bother it, then I will just do a different movement pattern. And sometimes it's as easy as changing the grip. Sometimes like barbell presses don't feel real good on my shoulder or my elbow. So instead of using a barbell, I'll use a dumbbell or a football bar. And just that minor change right there allows me to do pressing work, and it fits right in with my conjugate method training. I spoke earlier about in the month about exercises that I will not do, and instead I do other exercises, and this really falls in line with that. Another problem with going to the doctor is when you go to, like, say your general practitioner, that the chances of that doctor having the training to really diagnose what you have going on is minimal. It's a minimal chance at best. So what they're going to end up doing is they're going to refer you out, and a lot of times they're going to have you get an x-ray, because it seems to me that that's the way the insurance system works. They're going to send you to get an x-ray first to rule out a bone injury. And the problem is, a lot of these injuries are soft tissue injuries, and the x-ray is practically useless. Now, if the x-ray comes up and shows that you've got like some abnormality with how your shoulder or your rib cage or something like that is set up at this time, then that could give you clues as to why you're having issues. But if it's a muscle tear, that's not going to come up on an x-ray. You're going to need an MRI for that. So it's, in a way, you can kind of avoid all that expense by doing some stuff yourself. So I know a story of a guy who a doctor was telling him he needed rotator cuff surgery. And the guy, my friend who was training with this guy, kind of put him through a 6-week protocol where he strengthened his shoulders and worked on external rotation a lot, and the dude never needed surgery. So training sometimes can resolve an issue where a medical professional thinks you need surgery, but you actually don't. I also spoke earlier in the month about how to avoid spinal fusion surgery, and I highlighted a story that a professional wrestler named Val Venus shared in a shoot interview. So there are ways to avoid this, but specifically to the hands, I'm going to speak here by experience only, and I am not a doctor nor any sort of therapist. I simply have 22 plus years of experience, and I'm glad in this case that people are reaching out to try to take advantage of it. But keep in mind that I also have a multitude of products that I sell, so you may also want to check out my products and see if there's something that will help you with whatever issue that you're working on. For instance, I also have a product that I forgot about called Fixing Wrist Pain. So that can be very helpful as well. And again, I teamed up with Rick Caselge on that one. So here's a little story. On Friday, my good friend Jim Wagner, he's the guy that you've seen in videos many times, helping me with my hand injury, doing dry needling, instrument-assisted soft tissue mobilization, and other forms of soft tissue treatment. He came by this past Friday, and we hung out for a little bit, and we decided to do a picture. So I'm like, well, before we do this picture, I got to get a pump on. And I went over and I grabbed, I think, 20 or 25 pound dumbbells and just hit like 3 curls. And dude, both wrists were killing me. So that was alarming, because not that I gave 2 shits about the picture we were going to take, but I had a contest the next day, the Napalm Nightmare World Championships, which, by the way, the results are already entered into the Grip Sport database, because Eric Hussein is freaking awesome. He's an absolute gem. I didn't even send him the results. I posted a spreadsheet on the Grip Board. He pulled that down and used that to upload the results. Phenomenal dude. Could not do any of this without him. But I knew that I had a contest the next day, and if my wrists were bothering me, that wasn't going to work, brother. So what I did was some simple band traction exercises that Dick Hartzell showed me in probably 2009, if not earlier. Dick Hartzell was known as the band man for years. He's the guy that really introduced bands to powerlifting. He introduced them to Donnie Thompson. He introduced them to Westside Barbell, all these guys. And he's the dude that we have to thank for and credit for originating a ton of this stuff. So I did some quick band traction, 1 set with each hand, and the wrist pain was gone. So in the wrist, you have many little bones that are stacked neatly on top and in line with one another. And if one of those bones gets out of whack, it'll throw your whole wrist off. So it will create pain, it'll reduce your mobility, and definitely your strength output. So what I've found is through some band traction, I can knock those bones back into alignment by creating space. Now, why do those bones get out of whack? I don't know. It's just something that happens sometimes. Maybe straining too hard, doing an exercise I haven't done in a while, getting into a position like push-ups, which I actually did, now that I think about it, do a push-up position recently. So you don't see me do push-ups on here because my wrists are so tight I can't really do push-ups well. So normally if I do push-ups, my hands are on something so that I'm not forced into extension. But that I did do a couple push-ups as a demonstration recently. So maybe I threw something out of whack and that's why my wrist was bothering me. But the point is I was able to address that and compete pain-free on Saturday. Another thing that I've had good luck with is ultra low resistance for ultra high volume in order to flush blood into an area. So if I have a little issue here and there in my hands, in my wrists, in my elbows, and it feels like it's a soft tissue injury, not a bone alignment issue, then I will do some sort of basic and very simple movement pattern with very low resistance and very, very high repetitions in order to flush the area with blood. Now, this doesn't usually fix the condition in just one session. I've got to do it for several days, maybe even a week or two, not every day, but several times over the course of those weeks. And it seems to me that the extra blood helps the area heal, speeds up that process, and before you know it, the pain is gone. And usually I forget that I even had it because I just keep waking up and it's hurting less and less. One day it hurts 0 and I forget about it. So these are a couple of things that I'll do in my training. I'll also pass these things on to my clients and have them try them. And pretty good success rate. Now, if you've torn a muscle, this ultra low load, ultra high volume deal, it's not going to do shit. You're going to need to address that more professionally and in much more detail. So this stuff is not going to work for everything, but you can certainly kind of take some extra time to make sure that it's not something that you can fix yourself before you go to the doctor, spend money on a copay, and have to pay for x-rays and MRIs and avoid surgery, because some surgeons are dying to get their cut on, brother. And whether you need it or not, maybe they'll tell you you need it. I don't know. I don't want to badmouth anybody, but it seems that way. That's my perception. So hopefully this little discussion has been helpful. You can feel like you're hurt, injured, or have a condition and address it yourself. But understand that I have been doing this for 22 years. I've gone to countless strength and conditioning clinics and expos and seminars, interacted with all kinds of people. I'll bounce questions off them. They'll address these things in their talks, and I note this stuff down, and I go back and try it, and I remember it, and I try it when I get hurt and stuff like that. So I've had these experiences that lead me to have this knowledge in my back pocket that I can pull out when I need it. So I don't want to say that you never go to the doctor. That's not what I'm saying. But it may be the case that if you work with someone with a little bit more experience, then you might be able to address the issue yourself without having to go a more formal process with a medical professional. This does not mean that you need to come and leave a comment on my YouTube every time you have an injury, by the way, that gets old. If it's wrist, get fixing wrist pain. If it's elbows, get my product fixing elbow pain. So, you know, you can support me financially rather than asking for free information. So keep in mind, I did those 2 products with a medical professional, Rick Caselge, and he is good with this stuff. That's why I went to him. And I just can't answer every question that has to do with injuries. Like every week, at least every month, I get an injury question, and like, sorry dude, I don't know you. I can't give you this information and then get myself wrapped up in liability that will result in a lawsuit. So I hope it's been helpful. If so, give it one of these. Be sure to subscribe, and I'm going to get back on the foam roller because that's the only thing that's made my upper back and neck feel better, and hope your training's going well. Oh, take care. Don't look at this. This is the next video, okay? First off, part 2, because I realized I didn't actually address the question fully. The severity of your injury is going to dictate how quickly you need to go to the doctor. I would suggest doing some of your own stuff for a day or 2, maybe a week. But if the pain doesn't go down, if nothing is really changing, then yeah, you're probably going to have to see a medical professional. And obviously, if there's bones sticking out of your skin, if something is keeping you awake at night, I would say that those 2 things are going to be much more severe than just a soft tissue injury that you can address yourself or a bone misalignment. So after the course of 2 to 7 days, you're probably going to have an indication of whether or not you're going to need professional assistance. Use your network, see if anybody else can help you. Try to get like an indication of what you're actually dealing with. Try to address it yourself. And if those measures don't work, then it's probably going to be time to see a professional. Thanks.